You're indeed welcome to this video, and this video is one I'd really prefer not to make. We're talking to Mel Givrimont in Sydney, Mel. So thank you for coming on, and it's nice to meet you.
Thanks for having me.
Now, should we start off with a few pictures?
Yeah.
Yeah, let's start off with a few pictures of Mel because I think they really do tell us a lot about this series of events, really, Mel. Just talk us through this first picture.
Well, the picture on the top is me. God, that was just a few months before the first and the second jab. Um,
Yeah.
Look, I've been someone that's been fit my whole life. I've been an avid snowboarder, surfer, rock climber, paddleboarder. Look, I'm someone that doesn't really skip a beat. And so for me to find myself in a wheelchair is quite foreign. I guess you never really plan to end up in a wheelchair, but unfortunately that's where I'm at today. I'm still learning how to adapt with my new disability. But somehow I do hope that down the line I may regain some function and more mobility, and get back to the sports that I love.
Let's just look at some more pictures if that's okay. And thank you for sending us these, Mel. It's good of you to share them. What are we hoping to illustrate with this one, Mel?
So before the jabs, I had quite smooth skin, and after the first and the second jab, this is what started happening. Throughout my whole body, I just started having protruding veins, and really unexplainable. There was really no other reason but that. It sort of took me a while to clue in that it was that, but it would get a bit worse every time I would eat. But I sort of just thought, I had just had a baby about a year ago. So I thought, look, maybe it's related to that. I didn't really spend too much time analyzing. I thought it was strange. But look, after having a child, your body goes through a lot. But it's only once I was told that I had post-vaccination syndrome, did it all make sense.
Hmm. And that's an excellent picture of you. It looks very complicated, clearly involves quite exceptional balance, I would have thought, Mel.
Yeah. I'm not the best, but I mean, I love it. So, yeah, it's a work in progress.
Looks good to me. Now, this is, of course, a much less desirable set of pictures, Mel. Do you want to tell
Yeah.
us what we're looking at?
Look, I've been through the medical system a fair few times since having my side effects. And look, a lot of it was, if I think the first top one was when I was hospitalized for a week. While I was in hospital, obviously the doctors were trying to figure out what was going on with me, why I was losing so much function, why I was fainting, why I was having, at one point I couldn't walk, like, my hips just gave out. I had electric shocks everywhere. And it's during that stay sort of that I got a bit more answers. And look, we went through a number of blood tests, and everything was clear. So it was quite frustrating not getting any answers until obviously the doctor finally put the finger on it. But it took a long time for me to get an answer. Unfortunately, I got injured after the first and the second, and I didn't know I was injured. And then I went for my third Pfizer vaccine, and that just tipped my body over the edge. And that's post 3 jabs.
Hmm. And there are rock climbing again, all impressive athletic abilities.
Yeah,
And
it's
when
quite
was
a
this? When was this photo taken, Mel?
So this is just pretty much in my backyard, just about 50 meters from where I live. So we live right beside the beach. And unfortunately, we're selling our home just to be able to get a home that's wheelchair accessible. But this is where I would spend most of my time. Look, we live, yeah, 50 meters from there, and we have the surfing beach, which is like a 5-minute walk. We
Mm.
have, 7 other beaches that are walking distance. So, I mean, we live in paradise. We do live in a
Sure.
gorgeous area. Yeah. So it's quite different not being able to enjoy the sports, the water sports that I once did for sure.
Hmm. Yeah, climbing. I mean, it's very kind of you to share your personal pictures with us, Mel. Now we do have one that you did want us to see, which is a video, isn't it? Yeah, tell us what we're looking at here, Mel, please.
That's just uncontrollable shakes, really. That's been going on for quite a while now. I would say it was not as intense after the second jab, but after the third one, it became yeah, after the third one, it definitely intensified. And it's uncontrollable. It's quite strange. And it can happen at any time of the day for no apparent reason. There's nothing that
Mm,
really sets it off. Um, and so, I mean, some days are better than others, but really there's no triggers for this. It just happens. It's just my body that kind of takes over.
mm, mm. What I'd like to do, Mel, if you don't mind, is sketch out a bit of a timeline. So you've had three Pfizer vaccines.
That's right.
Roughly, what kind of dates were those?
So I had my first Pfizer jab. It was August 2021. And then three
Yeah.
weeks later, I had my second Pfizer jab. It was September 2021.
And what did you notice after the first one in August 2021?
So after the first, I noticed some tingling in my hands and my feet. And after the second, it progressed into, well, it intensified essentially. I started noticing some burning in my hands and my feet. And it was this weird, it felt like I had electric shocks going down my feet and my hands, as if I had a TENS machine that was kind of like zapping me. I didn't really understand at first, but it got progressively worse as the months went, like weeks and months went by. I started having unexplained weight loss, um, as well as weakness. So I would go to the gym 2, 3 times a week. And while I'd be at the gym, I couldn't keep up. There was just something that was completely different. My range of motion was restricted, which was quite strange. As if I was turning into a little old lady. I was sensitive to touch. I was sensitive to light. I started noticing my protruding veins, and those symptoms progressed to a point where it was quite painful. I distinctly remember that numbness in the soles of my feet, to a point where it was getting hard to walk. But, given that I had just had a child, you know, less than a year ago, I thought, well, initially I thought it was enzymes. I was taking some enzymes to help me digest. I stopped them. Nothing changed. And then I thought, it must be some sort of post pregnancy diabetes. I had convinced myself I had diabetes and I had this neuropathy that arose from it. And I went to go see a doctor, and after running a panel of tests, everything was completely fine. And the doctor asked me, do you take medications? Do you smoke? Do you drink? But not once did the doctor ask me, have you had the jab? And if so, when? And I wish the doctor would have asked me and was knowledgeable, because with that information, I could have prevented further injury. And I mean, I've had the chance to meet a lot of vaccine injured in the last year. And I mean, one of the things we see is that, once there's an injury, then the doctor will say, well, just go get a different brand of vaccine, without really questioning. You have to question the rationale. If someone has been injured, um, why would they do better with another brand? So with myself, it was around that time that, they advertised the boosters. So I said, okay. I know I hadn't caught COVID, so I went ahead and booked my appointment, and that was in March 2022. Um, and that really tipped my body over the edge. That was like essentially after having the third Pfizer jab. And at no point did I get a list of side effects, right? Like for me, I was just, oh, don't worry, it's fine. It's very rare to have any side effects. I don't like needles. So I said, okay, I had just heard, and then they said the usual, the chances, it's very rare, and you may just, in a rare case, you may just get pericarditis and myocarditis, but don't worry about it. So anyways, I had the third jab, and I ended up, sustaining severe fevers that night. I was extremely unwell for days to come. My bones hurt, my joints hurt. I was going from hot, cold. But in my head, I thought, well, wow, it must be really working. I'll really be immune. I won't catch COVID. And so that sort of settled down after a few days. But then that kind of like electricity that was going through my body before, those zapping and the burning increased to a point where it was actually physically hard to walk. And it was a weird sensation, as if my body was contracting. So even doing a stretch of my calf would put me in pain. I even, at one point I went surfing, I went over a wave, hurt myself, and saw a functional practitioner who was trying to help me to overcome my back injury. And my partner said, there's something wrong with Mel. Like her nervous system, her nerves are inflamed. We don't know what it is. And he did some simple manipulations and some nerve gliding, and I ended up in the ER with excruciating pain. And I had no idea what was going on. And he said, the practitioner said, I think you have some sort of neuralgia. There's something not right here. They did an MRI of my spine, and everything was fine. So I went back home, and over the weeks and months that followed, things just progressed. It was hard to walk. It was hard to lift my kids. I was extremely weak. I was having stabbing pains that would come and go. I would get extremely dizzy. So from the sit to stand, I would get extremely dizzy. I even went to a beauty salon once, and I couldn't feel my legs. So when I tried to get up, my legs completely just collapsed. I just collapsed on the ground. And I sort of, laughed, brushed it off. But all those symptoms were sort of, just progressing. And I knew something was up, but again, I thought maybe it's related to post-pregnancy hormones. I started noticing things like the shaking of my hand. So I had to stop basically all the sports I was doing, just focus on my kids. And I did get COVID in July. It lasted for 4 days. And I overcame it, and I was fine. I was completely fine. But just that same kind of electricity, the zapping, the burning, the pain just continued. It was one of those, it's as if like, after my first and second, it was almost like it was a slow burn, but then it progressed fast until I got my third, and then it did the same with the third. And so by September, I pulled my wrist, just dog walking. And it was weird because it was this nerve pain that was just electric. And 3 weeks later, pulled my other wrist. I thought, God, I'm really unlucky. Something, I'm having the worst of luck. And then went for an MRI of my two wrists, and just putting my hands over my head in the MRI machine gave me bursitis and a torn tendon in my shoulder. So I thought, okay, at this stage, I've been a very active person my whole life. I snowboard, I surf, I rock climb, I kayak, you name it. I've taken a fair few tumbles in my life, and I've never broken down at this alarming rate. So a few weeks later, by November 2022, I collapsed. I fainted. And at that stage as well, we didn't know what was going on, so rushed me to the hospital, and spent a week there. So those pictures, one of the pictures that you saw, was in the hospital for a week. They ran a panel of blood tests, and I was under the care of a rheumatologist who has 30 plus years of experience. And so I was concerned that I was having something called Ehlers-Danlos syndrome, or some sort of connective tissue disorder. And the doctor said, look, no, that's not what you have. I believe what you have is post-vaccination syndrome and potentially post-viral. And she said, there's nothing we can do here. Head home and do some physiotherapy. But at that stage, I couldn't even walk. Even taking the slightest step was hurting. My calves were contracting, my neck was contracting. I was completely disabled, and so they gave me a walker in the hospital, and they sent me home. And so I went home, and I was bedridden for about 6 weeks. I couldn't move. My spine was completely seized up. And it's only when I met one of my friends who's a kinesiologist, who said, "Well, Mel, you know what? We've seen a lot of people, like you in our clinic, and have you heard of Jab Injuries Australia?" And I said, "No." And she's like, "Well, it's an offshoot of Jab Injuries Global, and essentially what Jab Injuries Global is one of the biggest public archives of COVID-19 vaccine injuries." And when I went on that, I was shocked. I was shocked to find people like me, like it was one, kind of comforting to know I wasn't alone. But second instance is it was sad. It was sad to see all these people that were suffering. And so since then I've been lucky enough to join their team. Um, so, and it's a great platform for people to share their stories. We interview every single person before, posting their stories, and essentially it's a platform for people to find support and to be heard. Because when I went looking for help, it was extremely hard. After having sort of that diagnosis, um, when I would talk to my doctors, they had no idea what I was talking about, and their head, it was like, sleep it off and you'll be better, and obviously, some of the doctors, even the doctors that I've seen recently, had never heard of a COVID-19 vaccine injury. For them, it was, you just a few, symptoms that will dissipate over, 2 weeks, and you're fine, So, uh, for example, I went in for an ear infection because I limp. Um, the doctor said, "Oh, you're here for your limp," and I said, "No, this started with my vaccine injury." And he said, "What do you mean vaccine injury?" And I showed him a video, very raw footage of a vaccine injured, the before and after. And he said, I had no idea. He said, "We're just told they're safe and effective. We're told that we have, there's obviously we have a list of side effects, but the main ones that we've heard of is pericarditis, myocarditis." And he shook my hand and he said, thank you for coming in. I've sent many patients, and who knows if some of them have been injured. And so even today, I spoke to another doctor, and I asked her, I said, what are you guys told about these vaccines? Because I know there's been a lot of pressure for the doctors to obviously to push a positive narrative, and a lot of people are scared to put it down that it's a vaccine injury. But she said, "Look, we're given the list, but we don't know that much about vaccine injuries." She's like, "I surely didn't know that neurological issues was a big one, and things like autoimmune diseases, onset of type 1 diabetes, all these things, like she's completely unaware." So then you ask, how can you get help when they don't even know that it's happening? You're not being recognized, essentially. And so I'm a year and a half later, and I'm still suffering. I'm still declining, and we still don't know what's going on. I've seen neurologists, I've seen a few neurologists, I've seen rheumatologists, I've seen an immunologist, and the consensus is that we don't know how to help you. These vaccines are too new. And so and at this point, they've offered a few theories and a few, I guess, they're willing to trial a few things, but everything's just, a shot in the dark, essentially.
At the time you were actually vaccinated, Mel, just going back to the first time, I mean, you just got a very slight pain at the time of the injection, and then basically you thought nothing of it. How long was it before you thought, just a minute, there's something not right here? What was the kind of time
Yeah, the
lag?
first one I did have a reaction, actually. I did have that, had severe joint pain. And my bone, like a bit like the third jab, everything was hurting. So my body was hurting. I had a fever, but in my head, like I said, I thought, yes, I'm going to have better immunity. This is going to, I won't catch COVID. And so I just thought I was part of, routine side effects.
These were what, within a 24 hours, 48 hours?
That's right. So the night after having the jab, I did sustain those side
Right.
effects.
Yep. And then, so basically, burning, shocks, weight loss, tiredness, the vein standing up, the numbness in your feet, and then another vaccine 3 weeks after that in September. And did the symptoms get immediately worse after that?
Yeah, I would say within 5 days. I think it took me a while to kind of catch on that it was like obviously I didn't know it was vaccine injured, but to realize that it was that because I was busy, I have kids, so I was running around and we initially got the vaccines because we were stuck in New Zealand during the pandemic, so um, we had no choice but to take the vaccines to be able to board the plane. So we were busy packing up and trying to get back. So yeah.
The 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 electric shocks and burning feeling. How severe is the pain that generates? You normally
Well,
do it as a scale out of 10, with 10 being terrible and 1 being mild. I mean,
um, yeah, at this stage it's a solid 9. So it's now
that's
it's everywhere.
terrible.
So it's everywhere on my whole skin is on fire. So it progressed to like my mouth is on fire, my back is on fire, my legs are on fire, uh, my calves, everything, and it's sort of it moves around, but it never goes away. It never ever goes away. It just
So you've
it,
got some level of this burning electrical pain all the time, essentially.
yeah, absolutely, yeah, yeah,
So
yeah.
you
It
won't be
never
able to
goes away.
sleep properly and things like that. It must be affecting
Look, I
everything.
have to put ice packs all over my body to just find a bit of relief. Um, I also have blurry vision. I'm starting to have stabbing pains in my brain, which is quite frightening. This weird head pressure. I still have, pain from hurting my shoulders. I have twitches all over. I've had menstrual changes. Yeah, hip pain, but it's like electric. So whenever I move, it's kind of like electric shocks, which is very strange. I have tendonitis in many of my limbs. Um, like I said, I have it's like pre-fainting where it feels like, you know, I'm about to pass out. It feels like I'm breathing through a straw. So it sort of just comes and goes. There's no warning signs. I can't support the heat anymore. When it's too hot, I feel like I'm gonna pass out. I'm lightheaded. Look, it's a very long list of side effects, and they're ongoing. And that's the thing. They're ongoing, and they're increasing. And so I'm at a point now, so where it's like, what do I do? Like where do I go from this point? And I want to be there for my children, and I want to find a way to, get better. I just wish there was some, early treatments, early detection and early intervention to be able to, possibly stop the progression of this. So it's I try not to think about the future because it's a bit scary at this stage. So I just think of the now and I try to get through it. And look, I've looked at a number of therapies, and because my doctors have said, look, their theories is that one, it could be too much spike protein in my body, and it could have led to some sort of autoimmune response. And it could be also because I do believe the last test, my IgG test, was elevated. And also it could be some sort of microclotting that they're not picking up with the D dimer. But again, it's just theory. So I was, my immunologist said we can try a strong dose of immunosuppressants. So I'm trying to hold off on that. I've tried many therapies such as acupuncture, Chinese medicine, red light therapy, and we're looking at things like hyperbaric oxygen chambers. But everything is sort of like anecdotal, right? So what works for one doesn't necessarily work for someone else. I'm taking nattokinase and therapeptase, I believe it's called. So look, I'm taking a bunch of natural supplements, but I can't say that I'm seeing a, a drastic change in my condition.
If anything, after 18 months, you think you're probably still somewhat deteriorating, Mel.
Yeah, exactly. And you know, and that's the thing. It's like a lot of these doctors, unfortunately, what I find is really hard is that everything is you know, I have to pay everything out of pocket because obviously we have a compensation scheme here in Australia, but the eligibility criteria are extremely restricted and limited. And so I think there's only under 15 clinical conditions that can qualify, and we know that there's all these, you know, side effects. I think there's what 1,000 plus potential side effects just with the Pfizer vaccine. For myself, I have a long list of side effects such as neurological issues. We've seen a lot of people with autoimmune type 1, and so no one really qualifies, you know, and that's one of the hardest things that myself and other vaccine injured, you know, we have to pay out of pocket, and it's extremely taxing given the fact that we don't know if these treatments are going to work, right? Like I've been lucky. I've been lucky to have had a doctor that said, look, we think it's post-vaccination syndrome. And it's only when, you know, I found Jab Injuries Australia and Jab Injuries Global, and I heard the doctor say that, I said, okay, it's, you know, it makes sense. But I always think, you know, like there's so many people that don't have that doctor to recognize these symptoms. And so what we see through the board with a lot of the vaccine injured is that they get gaslit by the medical system, you know, and you know the doctors have been pushed to you know to share a positive narrative, and they're scared to put down that it's linked to vaccine injury. And a lot of the cases that we're seeing now is that the side effects are actually happening later. You know, it's not in the 2-week time frame. They're actually developing months down the road. We're seeing these weird autoimmune diseases. We're seeing all we're seeing the seizures. We're seeing like, and so it's not necessarily, you know, you don't get a diagnosis right away, you know, and so I really wish that, yeah, we would have a system in place and we'd have education, doctor education, to be able to recognize at an early stage these injuries. Because, I mean, what we forget and what we omit to remember is that for a lot of people that I've met, you know, these symptoms are not, these side effects are not mild and transient. You know, they're 2 years out and they're still suffering. And they may suffer for the rest of their lives. You know, they will need probably ongoing treatments. You know, just with Jab Injuries Global, we've seen the most atrocious side effects. You know, death being the worst, but we've seen everything from strokes, heart attacks, seizures, Bell's palsy, autoimmune diseases, amputations, and you know, it's all things that it's a very long list of side effects, and yet, you know, the media is not talking about it. Well, they're just started. We just had an article here in Australia on the front page about a young lady who passed away, but that, you know, she died a year ago. Why weren't we covering this, you know, a year ago when we were knocking at their doors saying we you know, we need help? You know, you have to ask why. What, there was no appetite. And that, you know, we have a few politicians here that are advocating for us, but there's a lack of acknowledgement, essentially. There's a lack of acknowledgement and a lack of infrastructure, and we really need to start building, you know, support systems for these injured, like myself, because essentially that's it. We're abandoned, and you know, we're abandoned. Once you send your like, I've sent my report to the TGA, or Therapeutics Good Association, and I haven't heard back from them, you know, as well as many other people. You know, they fail to follow up or investigate, and we've seen that even for near-death experiences, right? And so we know that there's a lot more injuries than what has been reported to them, because a lot of people don't report their injuries. So yeah, it's quite sad. I think I'm more on on the media side. Like I said, we're starting to see a bit of interest about this, but a lot of these people, or myself, like, I tried to get support online, and when I put a message, say, has anyone experienced a vaccine injury, my message got deleted. And so, how can you get help when no one will acknowledge you, essentially, and censor and silence you? So I think one of the big things is that the censorship needs to stop. The silencing needs to stop. Like, would we would we silence and censor someone that has cancer, or would we do the same for someone that has diabetes? We wouldn't, right? And so these people, and it's hard on these people and myself, because I think there's that a lot of people it's such a taboo subject to talk about vaccine injuries. And for a lot of people, they get ostracized when they talk about their vaccine injuries. I'm fortunate that I've had a very supportive, family and friends and all that, but not all of them have that, which is hard. So if we normalize if we open the discussion with the population, with Australians, then can we help them? Then can we find solutions? Here in Australia, there's like I said, besides jab injuries, and we have Coverse, which is essentially they're advocating more on to get recognition at a media level and at a political level, and they want doctor education, and they want to educate the doctors, and they also want to find treatments. So besides those two entities, I'm just left to trial and error all these alternative therapies, and I hope that we open up these long COVID clinics, and we add in the vaccine injured, because there's a lot of similarities, but there's also a lot of differences. So I think it's important to research, why are some reacting the way they are, and why are others okay, and down the road, I guess we'll get a clearer picture. But we need to act now, because we can prevent the progression, right? Like of these injuries. So look, I've been fortunate. Right now, I'm going to trial a few things, and we'll see in a few months if it helps, and if it doesn't, we'll just redirect. But I met a girl that was a bit younger than me, and she is. She's not as fortunate as me. Her legs won't work, and she is about the same thing. She has a similar time frame, and she's losing functionality of her arms and her core. And she has a small daughter. She can't look after her. It's extremely heartbreaking. The stories are endless, and yet we have no ways to help the jab injured like myself.
And I really want to emphasise this point. You had your first vaccine in August 2021, then in September 21, then in March 2022.
Yeah.
You didn't have COVID till July 2022, but your symptoms started in August 2021. So you had these symptoms after the vaccine, and then you had COVID. So we
Yes.
can't attribute these symptoms to post-COVID or long COVID, because you'd been vaccinated, getting on for a year, 10, 11 months before that.
I do think that that's another thing, is I do think that it probably didn't help with the progression of my symptoms, and that's another thing. We see a lot of vaccine injured that have had a stroke or heartache, and as soon as they catch COVID, it kind of makes them even worse. So it's sort of like, so yes, I had all these symptoms for a year, and I kept trying to self-diagnose myself, and it would have been good to have a diagnosis from the start. It would have been good to have someone to prevent me from further injuring myself. And that's quite, I even found a clinic not long ago who deals with vaccine injuries. And when I called them, they said, look, I was the fourth one that week that was bedridden, and one couldn't even speak. And they said, why did you go for your third? You were already injured. He said, no. You wouldn't have tingling, zapping right after, diabetes doesn't, neuropathy from diabetes doesn't happen that way. He said, why did you go for your third? And I said, how would I, I didn't know. No one picked it up. And that's the sad truth, you know. And I didn't even pick it up because, you know, we were told they were safe and effective. I never questioned the narrative, you know. I never even thought. And I asked myself, how many are like me? How many have been injured and don't know where to get help, and they're thinking they have all these things, you know, like I was self-diagnosing myself, but yet, you know, it would have been easy if someone said it's that. So you know, um, I hope that down the road, you know, we have better diagnostic tools.
It's a real pity that no doctors identified the problem after the first vaccine, then you wouldn't have had the other two, and
That's right. Yeah, yeah, exactly. Mm,
just complete ignorance, really. I think
yeah.
hard to explain. Actually, it's
And that's it. And even if they recognize that it's a vaccine injury, like I said, we've seen many that have been pushed to get a different brand of vaccine.
yeah.
So, you know, like, and we've seen some pretty atrocious things. So, you know, what's the rationale? What push, you know, what makes doctors say things like this? You know, you have to question.
I think, Mel, the fact that you've shared this will hopefully help nurses and doctors to learn about these things and raise the index of suspicion, as we would say in healthcare. But as well as that, there's people watching this video that are still suffering alone, as you did in the early stages, suffering not knowing that help is potentially available. So we're going to put the links to some agencies, some self-help groups. Do click on those. And most importantly, do go to your healthcare provider and say, look, I'm suffering these symptoms. In Mel's case, these basically unexplained neurological symptoms. Could this be a vaccine injury, doctor? You know, can I be investigated for this? And you know, don't suffer in silence. And I know, Mel, you've been kind enough to agree to come back to tell us more about these self-help organisations, the Vaccine Injury Australia, the Vaccine Injury Global. So do keep an eye out for that video. But I just want to thank you for coming on, because you're talking about something that's not easy to talk about, and it's your own personal suffering. And
Yeah.
and it's not only you; it's the effect on your family, the children.
Oh,
It's
that's right. I mean, it has ripples everywhere. But I do want people to know that are vaccine injured, that, you know, there's people like them, and together we'll find solutions, and we'll find, you know, treatments. But we need to be recognized. We need to be acknowledged first and foremost, and we need support on the government level. We need recognition in the media. We need our family and, you know, um, people in society to recognize us, and to support us to find solutions. And I think what I've noticed is that there's many promising promising solutions out there, and alternative therapies, and yet they're all working in silos, right? And
yeah,
so we need to really work together and find stepwise approaches to help the injured. So
get
I'll
this
be happy
problem
to.
out of the closet into the open.
Yes, absolutely, absolutely.
Yeah,
Yeah, we need to talk about the elephant in the room, and that's
absolutely.
important.
Mel, for now, thank you for your children for giving us giving yourself up to us for a period of time, and we
Thank
will
you.
talk again soon. Thank you very much for
Right.
coming on.
Thanks again.